Okay, with the continuity of the previous video or the first part of the introduction of ANS, I'm continue this second part. So build up the concept and answer this question. The neurotransmitter agent that is normally released in the SA node of the heart in response to the blood pressure increase is either A. acetylcholine, B. dopamine, C. epinephrine and glutamate, or norepinephrine. Answer your right answer in the comment box below. So adrenergic receptors, they are the membrane bound G protein coupled receptor, and the G protein coupled receptor are work on the behalf of the second messenger. What are the second messenger? They are the CAMP or IP3 or DAG. In some cases the activated G protein itself operate IC or calcium channel. So here is the basic difference between the alpha and beta receptor. Alpha receptor have antagonist. Selective alpha 1 antagonists are prazosin and yohim B, and the beta receptor antagonists are atenolol selective. This is the selective antagonist, and propranolol, that is non-selective. Effector pathway, again IP3 DAG or CAMP, because it is work on the behalf of second messenger. Okay, here you can see in the table 6.3 differences between the beta 1 and the beta 2 receptor. In the beta 1 receptor, the location is the heart and kidney. Selective agonist dobutamine, beta 2 selective agonist terbutaline, beta 1 selective antagonist atenolol, beta 2 selective antagonist is alpha 1 methyl propranolol. But in the previous slide, what we learned? Propranolol is the non-selective beta receptor antagonist, but the alpha 1 methyl propranolol is the beta 2 selective antagonist. So pick up this minute difference. Okay, in the table 6.4 you can see the alpha 1 and the alpha 2 receptors and its location, that is a post-junctional or the effector organ or the pre-junctional or nerve ending. Functions, you can see smooth muscles contraction, it have a basic role in the smooth muscle contraction, gland secretion, gut relaxation, because it is a rest and digest system. Alpha 2 receptor inhibition of the transmitter release, vasoconstriction, decrease central sympathetic flow. Alpha 1 selective agonist example is phenylephrine, and alpha 1 selective antagonist example is prazosin. Again, there's work on the second messenger pathway. Alpha 2 receptor selective agonist is clonidine, and effector pathway is CAMP. Again, it is a second messenger pathway. Neurotransmitter and neurotransmission. Neurotransmitter are chemical substances which transmit impulses from the one neuron to the another neuron, and from the neuron to the effector organ is called a neurotransmitter, or simply the process is called the neurotransmission. It's the basic definition. Type of the neurotransmitter, it is further have three types on the basis of its function, location and chemistry. On the basis of its function, it have the two types, that is excitatory and inhibitory. On the basis of its location, it have further two types, that is a central and peripheral. In the central, acetylcholine, DA, 5-HT and histamine. On the basis of its chemistry, it is further divided into the two types, that is amides or amino acid and peptides. As you can also see in these two words, amino acids, in the topic of autocoids. So it is a basic difference between or clear-cut difference between the cholinergic neurotransmitter and adrenergic neurotransmitter. Its precursor is acetate and choline. In the case of the adrenergic, phenylalanine. Enzyme for synthesis is acetyl transferase in the cholinergic neurotransmitter, as you can see in the previous slides. In the adrenergic neurotransmitter, tyrosine hydroxylase storage with ACH and ATP, and with Na or ATP in the adrenergic neurotransmitter. Release are same by the exocytosis. Postsynaptic receptors, either nicotinic or muscarinic receptor. Okay, it is a spelling mistake. Adrenergic neurotransmitter, either alpha or beta. Specific antagonist, atropine on muscarinic receptor, and D-tuberculin on the nicotinic receptor, prazosin on the alpha receptor in the case of the adrenergic neurotransmitter, and the propranolol on beta receptors. Some tracks in the psychopharmacology. Previously, we learned about the neuropharmacology. Here are the noradrenergic track. Second is dopaminergic track. Third is cholinergic track. Fourth is serotonergic. And the last is glutamate receptors. This is the basic sympathetic and the parasympathetic fiber origin and its innervation to the effector organs. So analyze your concept.